Hello, everyone, and welcome. I am very pleased to welcome you all to the fourth in the Global Evidence for Egypt Spotlight Seminar Series. This series is a collaboration between JPAL-MENA at the American University in Cairo and UNICEF with generous support from Allianz. We're really pleased to have you all here today for a really interesting and a really important conversation around social norms and gender. Specifically, we'll be asking, what does the global evidence tell us about shifting social and gender norms to improve development outcomes in favor of girls and women? And we have a really terrific panel conversation prepared for today. But we would also like for all of you to be a part of the conversation as well. So you should see the Q&A box in the bar at the bottom of your Zoom screen. As questions come up throughout the conversation, please feel free to write those into the chat, and moderators on our side will track those questions, and we'll have time for questions and answers at the end of today's session. So please do chime in. Next slide. I'll give you now a brief overview of the topics that we'll cover today. So we'll have opening remarks from UNICEF, from JPAL-MENA at AUC, and from the National Council for Women, before we open up for a deep dive into the global evidence from randomized evaluations related to social norms and gender by JPAL-affiliated professor, Dr. Eliana LaFerrara. We'll then hear a response to this global evidence and a perspective from the government of Egypt, sort of perspective on priorities around social norms, gender, and development for girls and women, from Dr. Nagla Adli from the National Council for Women. And finally, a development practitioner's perspective from Dina Hakel at UNICEF Egypt, before we open up to the moderated Q&A session. So now I am pleased to hand it over to Jeremy Hopkins, who is the UNICEF representative in Egypt, for some brief opening remarks from UNICEF.
Thank you, Alison. And let me start by thanking our partners, Her Excellency Dr. Maya Morsi, represented today by Director General Nagla Al-Adli, and also Abdelatif Jamil from the Poverty Action Lab for MENA, and of course Allianz, who you've mentioned, who is supporting this webinar series. I'm also really pleased to see so far 86 participants. That's, I think, a testament to the interest that this topic generates. And indeed, it's particularly appropriate the day after International Women's Day that we have this focused discussion. I'm really also interested because I think we need to deepen and place further emphasis on social norms if we're ever going to make real sustained progress to empower girls and women. We are always looking at the global evidence. We're always looking at how we can improve development outcomes in favor of girls and women, and I think social norms are a key ingredient of that. Egypt has, of course, made remarkable progress, I must say. I'm fairly new here, but you can see, I feel the progress. You can see the progress. You can see the commitment from leaders in government, not least of which NCW, but across the whole of government. I think that Egypt we need to recognize that as we start this discussion. Having said that, girls and women still suffer terrible levels of discrimination and inequality, whether it's at home, in the streets, in public domain, or in the workplace. Even in the way they're sometimes projected in the media and in drama. So at the same time, we're seeing much healthier enrollment rates in school. We're gender parity in primary, secondary, we're making progress. Less girls are getting married while they're still girls, before they've reached adulthood, and girls are having their first babies later, which is also key to positive development outcomes for women over time. So the discussion today is going to be an interesting one. I'm interested to see how we can understand better the global evidence, contextualize it for Egypt, and always with a view to creating a more equitable and favorable environment for girls to start off right, start off safely and with the best possible start. UNICEF is very committed to this research. We're also committed to the programming implications that will come out of this research, and we're very keen to integrate the learning from today and other similar sessions into the way we program over time, but also immediately. If we spot any quick wins or exciting discoveries today, I know that the team in UNICEF is very keen to see how we can quickly adapt and take on board this learning. The value of learning, I think, cannot be underestimated. We're normally rushing around implementing programs, and so once again, I do really appreciate this particular series of focused discussions that allow us to take a little bit of time, step back a little bit from our daily work, and think. And thinking is what we certainly need to do. You know, we know the world we want to see, and we know what we want to see for women and girls. But it's the how is the crucial bit that we don't always articulate as well as we can. And the more we learn, the more we research, the more we discuss, I think that the more likely it is we're going to get there. Once again, then, if I can thank the partners involved, JPAL, NCW, of course, and Allianz for their support. I'm really looking forward to hearing from Eliana Laferrara to see what comes out of this discussion. Of course, my colleague from UNICEF, Dina, and Dr. Nagla herself from NCW. And with that, I'd just like to reiterate our commitment to working together to achieve the best we can for girls and women in an equal world. Thank you very much.
Terrific. Thanks very much, Jeremy. And now I'll offer a few opening remarks and a bit of an introduction from JPAL. So if we've not yet met, I am Alison Fahey. I'm the Interim Executive Director of JPAL MENA at the AUC. And I'll give you a brief introduction to JPAL so that you can understand how the evidence that you're about to hear from our affiliated Professor Eliana Laferrara fits into the bigger worldwide picture, and to understand why we think that helping to cultivate conversations like this around how we can use evidence to tackle policy priorities is especially important. Next slide, please, Farida. So I'll tell you briefly what we do at JPAL. Next slide. As we all know, poverty, of course, is a complex and a multifaceted problem. Jeremy just did a nice job at laying out the aspects related to kind of poverty and human development that pertain to social norms and pertain to girls and women's empowerment. There are, of course, multiple elements to poverty. Yet, despite many years of hard work, tons and tons of investment, what we still see today is the staggering fact that nearly half of all people in the world are living on less than $5.50 per day, are struggling to make ends meet, and that many millions are still living in extreme poverty. So a question that motivates JPAL is what programs and policies will actually be effective at trying to help move the needle on this question, at trying to reduce poverty and trying to improve human development outcomes. Next slide. So our mission as an organization, as the Poverty Action Lab, is to ensure that policy is informed by rigorous evidence and that research is translated into meaningful action in terms of policy decisions and program designs. So we do this in three ways. First, through our network of more than 200 affiliated professors worldwide, of which Eliana is one, we conduct randomized evaluations to test and understand the impact of different innovative development programs and social policies. And together that generates a really rich evidence base that helps us to understand what seems to work really well, what seems to be promising, what maybe doesn't work as well as we would have thought, and we need to tinker a bit more. So today you'll hear quite a lot about the global research and the global evidence related to social norms and gender. We then move on to conducting policy outreach. So we want to work together with partners from community organizations to national organizations, NGOs and government, and to international organizations to share what we're learning and to help them think through how insights from the research could be useful and helping to strengthen program design and policy design to accomplish maximum impact. We also work on capacity building and training partners on how to conduct impact evaluations and how to use evidence in decision making. So those are the set of things kind of that J-PAL does. We can move on to the next slide. And so we take a really interesting approach that's both very globally informed and also locally grounded. On the globally informed side, our network of 200 affiliated professors has conducted more than 1,000 impact evaluations of particular development or social programs around the world. And each dot that you can see on this map represents a single impact evaluation that's generated insights and lessons about what works and what doesn't. So there's this rich global evidence base, and we'll be drawing from a lot of that in Eliana's discussion today. We also are locally grounded. We have a network of 7 regional offices. Our 7th and newest is J-PAL MENA at the AUC, launched just last summer. And the regional offices allow us to really build a local team grounded in the policy priorities of the country where we are based and the region where we're based. And so we're really thrilled that J-PAL MENA is able to play hopefully a growing role in this conversation together with partners like the NCW that are really focused on questions related to gender and girls and women's empowerment. Next slide, please. So as I mentioned, we are proud to have launched officially as J-PAL MENA last summer at the American University in Cairo's School of Business. We have so far supported conducting nearly 30 completed and ongoing impact evaluations in Egypt and in 8 other countries around the region with a wide range of partners, and testing questions around the most pressing policy priorities that government is concerned about, that the nonprofit and foundation and international sectors are concerned about, from cash transfers and microcredit to job training, firm growth, women's empowerment, social protection, and more. We've also done quite a lot of work to conduct policy outreach and in-person and virtual capacity building. We can move to the next slide. And across all of this work, we have worked with a wide range of partners from a number of different sectors in Egypt. And I think we're especially excited to have today's conversation in the hopes that this is just an opening of a discussion around how J-PAL MENA can be a useful partner to the different organizations in government and in the social sector who are focused on questions related to social norms and gender, and to think about whether there are important questions that together we could evaluate to try to generate more evidence about what works and what doesn't, or whether there are more opportunities for us to share the evidence, like what you'll hear from Eliana shortly, to try to help inform your own programming and your own decision-making so that we can all benefit from the global evidence that does exist. So very glad to be here for the conversation today. And I'll now hand it over to Dr. Nagla El-Adly, the Director General of External Relations and International Cooperation at the National Council for Women, for opening remarks on behalf of
Good afternoon, and thank you. Can you hear me?
Yes, we can hear you. Please go ahead.
Okay, thank you. Good afternoon for everybody, and thank you, Alison, for introducing me. And it's my pleasure to meet with Mr. Jennery and Hopkin, and it is my first time to meet with him. Actually, I think it is very good opportunity for the National Council for Women to hear from you and share your experience with us on social norms and gender. Let me first tell you something about the National Council for Women and how it works. The council was established in 2000, so it is now 21st year has passed, and the council has around 27 branches, which is working with us on the central level in all governorates, and we have a complaint office receiving all complaints. At the same time, we are working with all stakeholders to make sure that women and girls are empowered in Egypt. I'm going to tell you something about yesterday. I don't know if you heard about it, but yesterday, and with the occasion of Women International Day, His Excellency Abdel Fattah el-Sisi, the President of the National Council for Women, issued his directives to the Superior Council of the Egyptian Judiciary and the President of the State Council to assign women for the first time in both entities in order to fully activate the constitutional entitlement to equality and non-discrimination, affirming on the merit of women in assuming various positions. And I think it is a very good step towards achieving full empowerment for girls and women. I'm not going to speak more than that, and I will just postpone the description of what we are going to do in the later on session. Thank you very much.
Perfect. Thank you so much, Dr. Nagla, and very exciting to hear about the new policy decisions from yesterday. Thanks so much for sharing that, and looking forward to hearing more from you quite shortly. So now I'm pleased to hand it over to J-PAL affiliated Professor Eliana LaFerrara. She is both a J-PAL affiliate, but also the Fondazione Romeo ed Enrica Invernizzi Chair in Development Economics at Bocconi University. And she'll walk us through some sort of synthesized global insights from the evidence around social norms and gender, and sort of set the stage for us to think about how these might apply in Egypt. So Eliana, I'll hand it over to you, and your slides look perfect. We can see them in the proper mode.
Great, I was about to ask. So first of all, thank you very much. I'm grateful to J-PAL, UNICEF, and all of you for giving me this opportunity to discuss together and learn from this panel on gender norms with a specific contextualization in Egypt. So what I'll try to do in the time of my intervention is to share with you a bit of what we've learned over the years through multiple evaluations conducted by J-PAL researchers about how social and gender norms are changing, and what interventions and policy approaches might be more effective to bring about this change in a desirable direction. So I'll cover three main blocks. The first will be discussion about empowerment of girls and women and why it's important. The second is how randomized evaluation can shed light on empowerment interventions and what type of approach RCTs or randomized control trials adopt. And finally, most of the time will be devoted to discussing what we learn from the existing evidence. So if you look at, kind of global statistics, we see that there has been a lot of progress in terms of empowerment. For example, starting from primary school enrollment, we have more girls now enrolled than in the past. And these primary rates at the global level have increased from about 64% in 1970 to 88% in 2018. So that's quite a steady progress. Also, if you look at birth rates from adolescents over the past 25 years, these have declined from about 60 births per 1,000 girls to 44 births. So again, a steady decline. The legal framework has changed. There's high-level legal and normative frameworks that are now quite specific about women's rights. And we do see more women represented in national parliaments and positions of power. Now, yet, despite all this progress, there are still very significant health risks and as well as economic, social, and political barriers for women worldwide. For example, 4 out of 5 girls complete primary school, but when you go to the next level, that is upper secondary school, only 2 out of 5 complete this level. Also, if you look at time use, women do over 2.5 times the unpaid care and domestic work that men do. And globally, if you think of, domestic violence, physical or sexual violence, a staggering 35% of women report having experienced this type of violence. So there is a lot of ground still to be covered. And we think that, accelerating this progress towards gender equality is crucial to achieve sustainable development goals, and that norms around gender are a key obstacle or a key aid, depending on how we manage to work with these norms to improve gender outcomes, okay? So these norms are basically rules of functioning that societies adopt and whereby people feel that they have to conform to the way others expect them to behave or behave themselves. And these norms can be centered around the self. So people have internalized norms about how they should behave. They can be norms about the family. What are the appropriate, quote unquote, division of labor between spouses or between different groups of people within the family, as well as norms about societal behavior, which behaviors are approved, which are sanctioned, and why. Okay. Now, as economists, it's not so easy for many of us working at JPAL to have something rigorous and yet accurate and informative to say about norms, because these are intrinsically complex phenomena, and that's why we start approaching problems by, first of all, taking stock of existing evidence. There's a lot of evidence from other social sciences, sociology, anthropology, political science, but also social psychology, of course, but also some evidence from economic studies that contains very useful information in terms of stylized facts, descriptive patterns, evolution over time of these norms. What JPAL does, and the group of researchers around us does, is to try and use a particular methodology that will address one aspect of the overall question, that is how you can attribute to a specific intervention that you accurately designed on the basis of existing knowledge, the effects that you want to see in terms of tackling poverty. So let me give you just a quick idea about how this method of randomized evaluation would work, okay? So first of all, you start from a population, which is what you have represented on the left, that you can see is kind of colorful. And it's not just to make the slide nice. Those different colors are meant to represent differences among people, okay? So some people might be wealthier, some people might be poorer, some people might be more progressive in their attitude, some people might be less progressive in the attitude. So typically, when we look at how certain programs or interventions affect the outcomes that we care about, if we let people decide whether they want to be part of the program or which program they want to be part of, what we're going to do is possibly confound some of these characteristics, some of these differences that you see on the left, with the effect of the program itself, okay? So what RCTs do is that, first of all, they kind of run a lottery, okay? To say, let's take the overall population and let's assign some of these people to an intervention and some of these people to a comparison group on which we will not do anything other than collecting data, okay? So you see how I've gone from a diverse population here to two groups, but each of the two groups still has that original diversity in it. It's not like I grouped all the dark red people on top and all the light pink people at the bottom, okay? So the randomization has this power, in large numbers, that because I'm just, tossing a coin to decide who received the program and who doesn't, I am not gonna create systematic differences between the two groups. The two groups will start off, before I implement my program, being very comparable, okay? So this makes me confident that if after the intervention, I see some differences, these are going to be due to my program, okay? Why? Because after the intervention, you see at the bottom, this is supposed to represent the improvement in the outcome I care about, okay? You see the comparison group already is showing some improvement, but this improvement, I cannot take it as, due to what I did as a policymaker. Why? Because it happened to a group on which I didn't do anything, okay? So this change is maybe due to other contextual factors, other policies that the government or institutions around me have implemented, or simply, there is some kind of natural trend of change that would have occurred over time, and that can be attributed to the individual characteristics. But now if I go to the bottom part and I measure the outcome in the intervention group, this intervention group will have a combination of two things. The first is the individual characteristics and the natural trends that affect everybody. But then there is an extra effect on top of that. And this extra effect is due to the program, okay? So I basically say of the overall effect in my intervention group, I can net out and subtract what would have happened without my program. And I take that part from the comparison group. And now the difference is what I can confidently attribute to the intervention that I ran, okay? So the reason I'm able to do that is that I know by construction that the two groups, when we started, implementing the program, were on very similar grounds. And this is the methodology that randomized controlled trials, or RCTs, adopt, okay? And Alison already mentioned there's actually a very large number of researchers around the world that have been doing multiple studies with this type of method, and a very large number of evaluations from which evidence has been built across sectors and across countries. So what I want to do now is to focus on those results from evaluation that have a clear message in terms of gender and women empowerment, and tell you about 4 key takeaways from what we've learned. The first takeaway is going to be that these gender norms can moderate or even block impacts of programs that maybe didn't have a gender focus, but still the norms are going to interfere with how they work, okay? So for example, a very interesting study that's been done with evidence from India, Ghana, and Sri Lanka has looked at what happens when women receive loans or cash transfers, and comparing households where there is only one business that is operated by the woman with households where there are more than one business, for example, one operated by the woman and one by her husband. And what they found is that in the first group of households, this inflow of resources had very strong and positive effects on the profitability of women's business, while in the second group, they didn't. Why? Because what happened was that these financial resources were redirected to the husband's businesses, okay? So here we have a social norm, which is, related to the bargaining power within the household that affects how successful this microfinance intervention is. And clearly, if you want to improve the growth in women businesses, in this scenario, you have to deal also with the balance of power within the household and how to change that, okay? Also, other evidence from Pakistan, for example, shows that if you have loans or business training that try to improve women's profitability in female-owned enterprises, some of these programs show limited success. Why? Because then there are norms that don't view, whereby people don't view very favorably the fact that women would run their businesses from outside the home or with outside interaction. And so to the extent that these norms block what type of activities women can undertake, these loans and business training have limited effects. The second lesson is that just giving access to resources does not equal control. And also in that sense, if you try to address multiple constraints all at the same time, this can be very promising. And I will tell you how we can even learn more about that. So first of all, there's evidence from multiple countries that shows that just giving financial resources without addressing those household dynamics that I mentioned earlier does not improve agency or gender roles. And also, you know, these business grants, saving groups, microcredit, eventually has limited effects on income generation and mixed effects on employment, because often it is provided without tackling those other constraints that come from the social norm environment at the same time. So here, there are programs that have been pioneered now in recent years by BRAC and many other NGOs, where basically people have been trying to increase the agency of women by giving tools to commit or to overcome imbalance of power, and these programs show quite some promise. For example, in the Philippines, giving commitment savings accounts that would protect women's money, increase decision-making power. In Zambia, offering access to contraceptives, you know, without necessarily sharing the decision on whether they should be used or not, showed promising impact on contraceptive use by women. And then I guess the, you know, the overall biggest change, which is what I was mentioning BRAC pioneered, is to think about all of these different aspects and include them in one big type of program that's called the Ultra Poor Program in the original language, and nowadays known as graduation approach. So what the policymakers do in this case is to give assets, so resources, but also at the same time training and coaching on life skills, okay? So that women are better able to, you know, take action on what they have. And this has shown very strong positive changes in income, consumption, political participation. Some of these evaluations now have a time horizon of like 9 years, and these benefits are really sustained over time, okay? Now, these, as you may imagine, tend to be expensive interventions because of the asset provision, the training, and so on. So currently, people are trying to unpack the different components and try to see how to make this more cost effective, but the evidence is indeed quite promising in this respect. Now, when we think about these norms that I mentioned, we shouldn't conceive of them as being you know, set once and for all. These opportunities for women to enhance their agency can vary over time. For example, there's quite some evidence that if you try to affect outcomes before marriage, this is feasible and works quite well. But once a woman is married, changing intra-household dynamics after that is a little more challenging, okay? So for example, when employment opportunities become more attractive, and there's evidence from India and Bangladesh, families are willing to delay marriage, childbearing, just to take advantage of these opportunities. Also, if families receive cash transfers in order to delay marriage or childbearing, they actually do so. And there's evidence from Pakistan and Malawi, as well as from Kenya, Bangladesh, and so on. But once you go inside a household that's already formed, at that point, the transfer programs and the decision don't really, you know, have robust effects, given the evidence we have to change intra-household dynamics. So this tells us that there is really a window of opportunity where we might want to be particularly active in the early stages of women's lives and during adolescence, because that's when many long-lasting investments can be made. Finally, I want to talk about very recent interventions that are, you know, in some cases quite innovative in the way they try to tackle the norms issue. And these are interventions that we have selected just because they are directly targeting norms that might be, you know, detrimental for women. So first of all, there's an extremely interesting program that's been piloted in one of the states of India, Haryana, I believe it is, which for 2.5 years basically engaged students in classroom discussions that were about adolescent girls, okay? So boys and girls try to talk about what it means to be a girl, what is your day like, what is your day like if you are a boy, what type of stereotypes are out there. Of course, maybe they wouldn't use the word stereotypes in this way, but basically the idea is to educate these teenagers early on. And then the team of researchers went to collect data. So this was randomized, in which schools, the program was implemented. And 2.5 years later, these students were expressing more progressive attitudes and were dividing household chores back home in a more equitable way, okay? And so this evidence, the fact that it was so carefully put together and so encouraging, has led higher levels of governments now to take it on. And just yesterday, the government of Punjab in India announced that this is going to be part of the school curriculum. So one experiment by one of our researchers has been embedded now in the school curriculum of the state of Punjab, which is quite impressive in terms of dialogue between research and policymakers. Now, there's some other evidence here, not through education in schools, but if you wish, into education through mass media. And in one study that I myself have done with Abhijit Banerjee and Victor Orozco, what we've done is we try to evaluate how TV series that are entertaining but also have an educational component might change attitudes and behavior. So we evaluated MTV Shuga in Nigeria with the randomized control trial. And one of the subplots of this TV series is about a violent husband. And what we found about 9 months after the intervention is that men's probability of justifying gender-based violence was lower if they had watched this TV series compared to the control group that hadn't watched it. Women declared less exposure to forced sex or to wife beating. And we also found that respondents who remembered the theme of the show and the characters that were involved in this domestic violence subplot are those for which gender-based violence at follow-up is predicted to be less supported or less prevalent. So there is promise in using this type of large scale productions to reach out to a large number of people at extremely low cost, because once the TV series is done, you can reach many, many viewers. And there seems to be a response in terms of changing attitudes and norms. And I think the reason we want to stress this is that sometimes when you have explicit educational programs, you might fail to reach certain segments of the population who are not very sensitive to that topic, while when you put out a show that people want to watch because it is, you know, on TV at night, you manage to filter and get through to large segments of the population. And some evidence from rural Uganda, again, on entertainment approach with videos about gender-based violence, also found increased willingness to speak up about violence and a decrease in reported violence in the community. Now, one of the very influential studies that have been done recently, it was published just last year, is actually a study about female labor force participation. It was done in Saudi Arabia, where even though when you poll people and you ask whether they are privately in favor of women working in the labor market, you know, over 75% of the population say that they are. Once you measure the actual female labor force participation, it's much lower at around 25%, okay? So here what this study found was that men actually underestimated the level of support from other men in society, okay? So this is called pluralistic ignorance hypothesis in in the theory underlying it. But basically what this tells us is that sometimes you have a private position where you would want to adopt a progressive behavior, but you don't do it because you wrongly anticipate that the rest of the people in society are still anchored to that older way of doing things. So what the researchers did was they randomized which of these men received information about others' opinions. So you can think of this subset as being informed that they were too pessimistic to start with. And once they received this information and they learned that, women working is actually quite accepted by other people in society, these men signed up their wives for a job search service. These men were more likely to say that they would, have their wives take driving lessons and so on. So just working on perceptions and aligning people's expectations with the, societies that are often progressive could be a tool in and of itself, okay? And with some colleagues in Somalia, we've tried to use a similar approach to, try and help with the problem of female genital mutilation, which is extremely widespread there. About 98% of women in the country are cut. And what we've done is we've elicited beliefs about, how many would support infibulation, which is the most, aggressive form of FGM. And we then announced in some of these groups and communities that the true support for infibulation was actually lower than they expected. And we are about to collect our endline data to see if this approach also worked to reduce, society's support for female genital mutilation. Also, speaking of female genital mutilation, I want to mention another thing that we are trying. Again, it's at the pilot stage. We don't have results yet, but together with Lucia Corno, I've been working in Sierra Leone to propose an approach that instead of telling people, look, FGM is bad and you need to abandon it, tries to isolate the part of the norm that people perceive as linked to their identity and their culture from the part that is harmful from a health perspective. So in Sierra Leone in particular, cutting is related to an initiation ritual that people care a lot about because it's, transition to adulthood. It's where girls learn a lot of things about how to become mothers and wives. And so with the local NGO, we've proposed an approach where the initiation ritual would still be kept there, but the cut would be replaced by another sign that the group would choose for themselves, just to say, you can keep your norm. Just replace the harmful norm with another norm that preserves the identity component, okay? So let me conclude. The four things I believe we have learned from evidence so far are, first of all, that gender norms, even when they're not your focus of action, can seriously interact with other programs, even blocking the intended impact. So it is crucial to tackle them at all levels. Second, you can't just think that if you give women resources, money, loans, transfers, they will be in a position to fully control those resources and make the use that they want. We need to, at the same time, address multiple constraints, okay? And increase women's agency on resources. Third, there are windows of opportunities along the life of a woman where shifting norms might be easier, and the sooner the better. So this should be kept in mind when designing, for example, education programs. And finally, we are trying to make progress. It's a relatively early stage, but more and more evidence is being produced on designing interventions that will directly tackle beliefs, misperceived support for harmful norms, and hopefully, align societies to the objectives that policymakers and the population themselves are more willing to support towards progress. So this is all I had to say, and I want to thank you for your attention. Give the word back to the panel. Thank you very much.
Wonderful. Thank you so much, Eliana, for, I think, such a rich discussion of so much global evidence, and for distilling that into these 4 key takeaways that I think I can certainly see how they have kind of paths to translation into thinking about how they can inform policy decisions with UNICEF, with NCW, and with other partners in Egypt. So that's really terrific, and looking forward to continuing the discussion. I'll take my moderator's privilege for a moment to comment on a couple of quick things. I think on your points around resources, a couple of really interesting things that we've found from research in Egypt recently is that first, returns to access to finance for women in Upper Egypt from studies that we have conducted with the Sawiris Foundation and with local MFI partners in Upper Egypt suggest fairly large returns to access to finance. So there's kind of some interesting questions to unpack there around access to finance, and on the bundled intervention and the importance of building kind of a perspective on gender together with interventions that address other constraints. Again, with the Sawiris Foundation, we're partnering together with BRAC on an adaptation of the graduation approach called Bab Amal, also in Upper Egypt, looking at the effects of access to this livelihoods program. So that's just an example for participants of the ways in which the global evidence that Eliana shared already is informing, thinking about new program and innovations that we should be trying and that we can test together in Egypt. And the final point that I'll make is that this note on the program, which is called Breakthrough, around having girls and boys in school talk about their perspectives that Eliana mentioned just yesterday, was announced by the government of Punjab that it's being incorporated into the curriculum, is a perfect example of the kind of big picture vision that J-PAL has to want to work together with partners who are the implementers, who are the programmatic innovators in designing these programs and testing them, and then identify which ones have great potential to go to scale and to try to improve lives and improve outcomes by reaching many more people. So that's a great sort of microcosm of exactly that path. So now I'm very pleased to hand it over to Dr. Nagla Al-Adly to hear the National Council for Women's kind of perspective on questions of social norms and gender, and to hear more from the teaser that she gave us in the opening. So Dr. Nagla, I'll hand it over to you.
Thank you, Alison. Here I noticed a question from Reem Sherbini, and she's asking about if there is a set of indicators used to mark progress for girls and women empowerment. Okay, I'm going to talk a little bit about how we monitor the achievements done for women empowerment. Let me tell you that we have indicators, and we are following up these achievements through National Observatory for Women. And this observatory actually established a baseline and follow-up indicators to measure and track progress. And this is actually not inside the council, but outside and through an independent entity. Let me tell you more about what has been done and what type of achievements and how we are working at the National Council for Women. Of course, Egypt has witnessed a notable positive progress during the last 6 years. Progress is recognized on several levels, starting with a strong political will to fulfill women's constitutional rights, as I mentioned before, what happened yesterday, and that is evidence-based as it becomes translated into strategies and programs that are implemented by the state and non-state actors. Actually, the strong political will has created momentum and space that enables stakeholders, including youth, academic institutions, legislators, religious leaders, rural women, and many other to advocate for and commit to the empowerment of women and girls at many levels. As you know, the Egyptian Constitution of 2014 established values of justice and equality and included more than 20 constitutional provisions that guarantee the rights of women in all spheres of life. In Egypt, Egypt was the first country globally to launch its National Women's Strategy 2030, aligned with the SDGs, and confirming the country's commitment to achieve the empowerment of Egyptian women and girls, and its will to play an active role in the advancement of women and girls. The National Strategy for the Empowerment of Egyptian Women 2030 was adopted by the President of Egypt in 2017, directive to the government of Egypt to adapt all its contents and consider it as a guide and roadmap for all the work concerning the empowerment of women and girls. The strategy has 34 SDGs indicators and is comprised of 4 main pillars: political empowerment and leadership, economic empowerment, social empowerment, and protection, with legislation and culture as cross-cutting pillars. So here we are talking about a comprehensive work, not only peace and peace. I'm going to talk or focus only on the intervention to change the behavior and gender stereotypes. We are working on raising the awareness of the society and advocacy campaigns as a cross-cutting pillar for the strategy. One of the main campaigns we are working on is the Knocking Doors and On-Ground National-Wise campaign. The campaign reached out till now around 35 million women on the ground over the past 3 years. The campaign relies on face-to-face communication with women in villages. The campaign also addresses topics such as violence against women, personal status law, legal rights, risk of FGM, political participation of women, and other women issues. Protection from FGM campaign, and it reached out to 54 million beneficiaries. And here we are talking about women, men, and children. The Secret of Your Power, which is very famous campaign, Ta' Marbuta. It is a national-wide campaign launched and reaching out to 153 million viewers till now. The campaign is based on an innovative approach that focuses on women's strength and addresses misconceptions, redefines gender roles, and fosters women's participation in all spheres of life. Because I am a man, it is a very important campaign because it engaged men and boys on issues of gender equality and women's empowerment issues, reaching out 480,000 men on the ground in all governorates of Egypt, as well as reaching out 17 million viewers on social media. For the first time, we launched Together We Serve Our Country, and it targeted around 700 religious women leaders to work on delivering messages on ground on topics such as reproductive health, family planning, combating early marriage. Don't let a station stop you. It was a campaign launched in one of the 4 most prominent metro subway stations to raise awareness about combating sexual harassment, family planning, encourage girls' education, combating early marriage. A social media campaign called Egyptian Women Role Models was launched with the aim of highlighting success stories and achievements of successful women in different fields on the social media as an encouragement for other women and young girls. The campaign presented 300 women as role models with 800 viewership. Another campaign is issuing the first media code of ethics, targeting media agencies to be more gender sensitive. 565 women club all over the governorates of Egypt to raise awareness about women issue, reaching about 362,000 women beneficiaries. And we launched several campaigns addressing cyber crimes, such as Speak Up campaign, anti-online bullying campaign with Instagram, women online safety campaign with Facebook, other videos with celebrities advocating for cyber safety. Last but not least, launching of awareness raising campaign on the rights of women with disabilities in the recently adopted law to raise women's awareness about their legal rights. This is part of what we are doing, but of course, I'm open for any questions and discussion. Thank you.
Wonderful. Thank you so much, Dr. Negla, for such a kind of rich overview of the kind of, I think, massive programming. And I know that we're hearing only a part of what the NCW is doing, both in person, on social media, and on television to try to address gender and social norms. So we'll look forward to hearing more questions about some of those programs from the audience shortly. For now, I am pleased to turn the floor over to Dina Heiko from UNICEF in Egypt. Dina, over to you.
Thank you very much, Alison, and thank you all for the great presentation by Eliana and the very comprehensive brief by Dr. Negla. We're very pleased to be here. Let me just start the conversation and really thank you all for this opportunity and this facilitation. Let me just start with the word social norms, and the key word here is social. By innate nature, as human beings, we are social creatures by nature. We thrive, and a lot of our behavior is really driven by what our reference group finds acceptable, what are the people that matter to us find acceptable, and how we relate to them, really. And I think Eliana put it beautifully, how these social norms can either be internalized. So we know, for example, for children at a very young age, these gender norms are, they start and are internalized at such an early age, and then they become compounded and enforced throughout their life course, and from what they see, from what they learn in schools, from what they see from their parents, and so forth. And if we see the negative social and gender norms upon us, how do we actually make that shift? How do we discontinue these harmful social and gender norms and replace them with positive ones that are emanating from communities and societies and are accepted? And here the keyword would be, how do we make the positive new norm more visible and promoted so that the negative one is discontinued and weakened and dissipates within the community and is no longer there. And I think Eliana also in her conclusive remarks, whether it's the bundled approach to things, whether how we use a multi-layered and a multi-dimensional approach to things, and also the multi-sectoral level, which I believe Dr. Negla also touched upon through the great and excellent work by the government of Egypt in the Women's Empowerment Strategy. We see now clear indicators, not just by government bodies related to gender, but all the ministries and all government bodies now have indicators clearly answering to this. So the multilateralism of it can be the starting point, really, from the policy and advocacy level, but also from the ground up. How do we encourage more and more communities? How can we create a critical mass and promote these positive new norms where we can reach a tipping point and it cascades and you create that diffusion where that new norm is finally accepted and adopted. As UNICEF, we work rigorously with and through the government of Egypt, and we're very proud of the strides that have been done. And the way we are working really is focusing on what we're calling the drivers of change, or what are the strategic entry points that we can perhaps tackle and kind of nudge and push that can perhaps trigger that effect, that can promote these positive new norms and make it more visible. These drivers of change, specifically when it comes to social and gender norms, first is the girls' empowerment. And by here is, how do we create an ecosystem where the girl is listened to and heard, the agency factor. She's acquiring life skills that are essential to her. She has access to services, but at the same time, she's supported by her family, community, society, and country as a whole. And through that, the UNICEF is proud to facilitate and support the National Girls Empowerment Initiative, DAWI. It comes from the Arabic word dawi sut, which means a sound with an impact and echo, through a multi-layered kind of approach. So through a governance body that under the leadership of the National Council for Childhood and Motherhood, in coordination with the National Council for Women and 6 other ministries: health, youth and sports, culture, education, of course, ICT and culture, how this governance structure can support the policy and advocacy front, but also integrate and mainstream the girls' empowerment within their already existing program. So we work on the individual level, starting with simple storytelling, safe DAWI circles, where girls are able to get the peer support needed. And then this is compounded and echoed through an intergenerational dialogue where they're heard within their family context. And later, the community, how it kind of comes into that and supports the girl. So the girl is not alone in this, but in fact, the gender constructs, the roles and the structures start innately, not just on the individual front, but throughout the entire ecosystem, or the socio-ecological model, as we say. Of course, this is complementing the already existing and great work that is already done on the national scale. On the second driver of change, as UNICEF and by mandate, the positive parenting approach, and that is how the positive gender socialization and the empowerment process starts within the nucleus of the family. How can we enable caregivers and parents to actually be part of that journey and process and take it forward, whether through face-to-face, the driver of change includes already on-ground work with Ministry of Social Solidarity through a face-to-face positive parenting program, capacitating both social workers and caregivers on the entire life course approach on how they can empower and deal with their children for their mental and physical well-being, but to much, much more than that. And of course, gender mainstreaming is an essential part of it, because as we have just highlighted, it is internalized by children, how they see the different gender constructs and structures within the family, how the father has an immensely important role, and how these gender roles are evolving towards more equitable relations within the household. But also I want to highlight something also said by Dr. Eliana on the use of media and entertainment in an educational way. Also UNICEF, in partnership, of course, with government and national counterparts, on an edutainment series modeling positive behavior on positive parenting, which gender norms definitely will be tackled in a more sustained and structured way, and how we can monitor the dialogue that is happening on ground by viewing of these edutainment series and be able to assess and see how this is progressing and evolving. And here the modeling of the positive behavior and bringing visibility to that as a potential start to weakening the negative social and gender norms that can that are already existing and that we are trying to kind of narrow down and deconstruct a bit. And of course, all of these are taken in tandem as a more holistic package. So the child that goes to the school and is learning and is joining the DAWI circles or the intergenerational dialogue, or the parents that are viewing the edutainment series, or attending the positive parenting class and the neighbors discussing it and talking about it, how all these elements are compounded together and are coming into this holistic and integrated structure to create kind of that critical mass. And those advocates and supporters of gender equality and positive social norms together, in an attempt really, and the potentiality to kind of shift these dynamics and power structures, and using these as kind of a nudge and a push towards a more sustainable development approach. Thank you so much.
Excellent. Thanks very much, Dina. It's great to hear about, I think, the series of complementarities between the many programs that the National Council for Women is running and those that UNICEF is running in Egypt, and some in collaboration. So we'll shift now in our remaining 20 minutes to having a bit of an open conversation and a discussion amongst the panelists. So I've been keeping an eye on the great questions that are coming through in the chat, and a reminder to participants who are with us to please add more questions to the chat. So I'll go ahead and kick us off with a couple of questions. So the first is around this question of who to target with programs. We've just heard from UNICEF that there's a stream of programming that's targeting parents, some that's targeting young girls directly. We've heard from Eliana about examples of programs that are targeting girls and boys together, or in the case of the really interesting research in Saudi Arabia, a program that is targeting men. So I wonder if we could maybe open it up to all three of our panelists, and would be interested to hear from you around whether you think engaging men and directly targeting ideas like conceptions of masculinity is an important aspect of this work, and how we should be thinking about, resources are limited, who should we be targeting, the individual, the broader family, the broader community? Maybe with that, Eliana, if you wanted to go first, and then we could hear, why don't we go in the order of our panel? So Eliana, Dr. Nagla, and Dina.
So I'm not going to give a very helpful answer in light of the budget constraint, because I really don't think you can target one of these actors. Let me give you an example of why. You might think that you want to empower young girls, do this wonderful program in schools. They become convinced, they go home with all these aspirations, and then the parents still think the way they were thinking yesterday. Nothing happens. You have created a lot of frustration and nothing else. So I think there are levels that need to change at the same time. These are across genders, women and men, but also across generations. An important part of this change when it comes to norms is between younger and older generations. And some programs that I think have been quite interesting, done in other parts of Africa, I believe it was Zambia, if I'm not wrong, involved kind of negotiation skills that young people would be taught in order to have a dialogue with their parents. What points can you bring about for why your requests might not be excessive as they seem, okay? So there's this element of facilitating dialogue between generations, possibly within the family. There is also the element of what people expect if they suddenly adopt new behaviors, how they expect to be judged. Now, in this aspect, I believe strongly that this type of broad, far-reaching communication approaches, like Dina was mentioning for the TV series, or the campaigns that Dr. Nagla mentioned, where all of society suddenly realizes that maybe this is approved after all. These have a lot of potential. Let me mention that demonstration is the first and most powerful tool. So appointment of women in positions of power and role modeling by prominent figures is one way in which you don't need to then go and communicate an awful lot. It's there, it's visible to everyone. And the last thing I will mention, and then I leave the room, is that many of the things we want to change are not kind of overt discriminatory behaviors or attitudes. Many of the things we want to change are stereotypes and implicit biases that people hold maybe without even realizing, because they grew up thinking that it couldn't be different, okay? So this idea that maybe this implicit and kind of subconscious associations that we make between what the women should do and what men should do, those might be best tackled by reversing the stereotypes through examples, either in real life or in the media, and they don't necessarily involve an awful lot of resources financially. So it's something that needs to be carefully thought through, but it is, in my view, part of the solution.
Great. Dr. Naglaa, over to you for again, your perspective on the question of how to decide who to target with different programs.
As I mentioned, here at the council, we are targeting men and boys. And it is maybe especially in very sensitive topics like FGM, for example. Still, we found out that there is no resistance as we thought previously. No, on the opposite, men and boys were very active with us and tried to understand what is the issue. And using the female religious leaders actually also had a very good impact on the stereotypes and norms and negative norms in the society, because they are very close to the people, and here in Egypt they listen very much to their advices. I would like to answer another question was written on the chat, and it was directed only to the National Council for Women. They were asking about the observatory and if the process is a participatory process or not. Actually, the observatory is a non-governmental organization. So when they designed the indicators and the tools to collect the data, it was completely a participatory approach and methodology. What is the obstacle actually is data collection, because data is not sex disaggregated data, and it's very difficult to collect the data especially from the governmental institutions and also NGOs. It's not easy task, but we are trying very hard to collect and work with the observatory in order to understand the gaps on what is already targeted in the strategy and what is happened on the ground. That's it. And if there is any more questions, I'm yours.
Great, thanks. And Dina, did you want to jump in on the targeting point?
Yes, I mean, it's an interesting question because, no matter how many resources you have, and in a country like Egypt, we have over 100 million people. So no matter how much resources you have, you kind of need to be a bit more strategic in how and when you target. At least the way that the approach is designed is that you kind of need to hit it at different levels, whether it's the individuals, the families, the communities, the societies, to complement what is already happening on a policy and advocacy front. So you kind of need to target all, but you need to choose who you're going to target. So if you're going to target girls, you can't exclude boys. I mean, gender is a construct. It's a construct by society. We actually all help build that construct. So we all have a role to play in deconstructing some of these harmful norms or practices that are associated with what we're doing. And so, for example, with Dawi and positive parenting, we have it sort of like a journey. So if you attend the circle and your parents are viewing the edutainment series, and then you attend the positive parenting class, and then you listen to the religious leaders, and then you talk with your neighbors about it, and then you have that community and intergenerational dialogue, you create multiple pathways and entry points. And that journey is more or less involving everybody, you know, instead of just focusing on just one target audience or one approach and then missing out the rest, and then realizing later on, as Dr. Aliana was saying at the beginning, some of these barriers will come back to haunt us, and it will kind of stop our programming from developing.
Great. So a consistent message there around the importance of kind of intervening with different groups, because we're ultimately talking about not only individuals, but households and communities. So I want to shift to another set of questions that is picking up on several questions through the chat and some points that Eliana raised in the beginning, which is a question of, okay, so, you know, we know what we're talking about here around gender norms. We've used the word agency a little bit. How do we actually measure these concepts? Like they're less measurable than, you know, your results on an annual exam in school or something like that. So it would be great to hear both from Dr. Naglat, picking up on your last point around the National Observatory and its efforts to generate data to monitor the progress of these programs. If you could share a bit about the sorts of indicators that you're building into those monitoring programs. I think there's interest from several participants to hear about that. And then Eliana, if you could talk a bit about how we think about measuring these difficult to measure concepts and how in impact evaluations you can actually get at things that it might seem difficult to. But Dr. Naglat, over to you first.
Okay, maybe it is going to be difficult for me to explore on the observatory mission, because as I told you before, it is an NGO and independent body, but we have specific indicators within the strategy, or national strategy for women. And for example, I'll let you know some, for example, we are measuring how many women in the senior positions in legislations, for example, or how many new legislations were released in favor of women and girls. Of course, for example, we have the new amendment for FGM legislation or law. And another thing, or another indicator is the, for example, the increase of the number of women entrepreneurs. How many laws and legislations are in favor of women, etc. But if you would like to know more about the observatory, it is, you can go to the online website, find out all your answer for all your questions. Thank you.
So maybe I can go next. Yeah, these are really important points, because we typically, especially if we're trying to do impact evaluation, we want to have some way to quantify improvements or changes. And when it comes to agency, it's a bit challenging. So let me tell you how it's been done, you know, so far, and then also what resources might be available out there. So in the type of studies that I have reviewed, often what is done is that in the questionnaire that we administer at the beginning and at the end of the evaluation, we include some questions about who takes certain types of decisions within the household. Okay, so we would say who's in charge of deciding on food spending, on health spending, who makes decision on whether or when to go and visit relatives, who makes decision on buying durable goods for the house, who makes decision on loans. So all of these things. And then we use these various indicators to build a measure of decision-making power where the fact that the woman will say, I do it alone, my husband does it alone, we do it together, is combined in some way. So this is something that is available also for third parties to use across countries, because the demographic and health surveys, DHS, typically have this battery of questions. So you could construct indices across countries where the DHS are administered. Now, one limitation with these self-reported measures of decision-making is, first of all, that when you happen to interview both the husband and the wife within the household, and I've done it in some of my work, you don't always get consistent answers, okay? So one person tells you, I'm in charge, the other says, no, I'm in charge. And so it's not very obvious whose word you want to take and what do you learn from the disagreement in their answers. So some people in a more limited set of studies and cases have been resorting to lab experiments where they have people play with money, okay? And they see how they use it. So for example, they would say, they would have an experiment with women where they say, here's some money, you can keep it for yourself, or you can share it with your husband. Here's an investment opportunity. If you take this, your husband will see what you've done. If you take this other investment opportunity, he will not see. So people check how much money you're willing to sacrifice to hide from the husband, and they take it as indirect evidence that maybe if you need to hide your money from the husband, it means that you don't have so much control over the way it's spent, while if you're equally comfortable, you have more control. So there are some measurements that have more to do with these lab type of experiments, but they're hardly, comparable or even available across several. And one of the J-PAL researchers who works most on gender, Seema Jayachandra, has recently written a paper where she compares these type of measures, DHS-based, lab-based, and then some qualitative work that she's done just asking women to talk about gender, and has some proposals on how we could measure gender. I just want to indicate a resource that I myself have not used, but I know it's available out there, and it's the social norms and institution indicators that the OECD has created. So it's a global database that tries to measure discriminatory norms and institutions around gender. And I think the website is genderindex.org. So again, if you're looking for some quick descriptive statistics cross-country type, that might be a resource. Measuring accurately within country and at a granular level is something on which we can still improve a bit.
Great, thanks very much, Eliana. So we have 3 minutes left. So I want to pose one final question that came from the audience to each of our 3 panelists, and to give you about 30 seconds to answer it. And so the question is, and maybe we'll start with Dr. Nagla, turn to Dina, and then close with Eliana, which is, what should we be evaluating next? What are the questions where if we only had answers around the impact of different programs, it could help us shift the direction of our programming, the direction of our investments? So where is more research most needed? So if we could do a quick 30-second closing on that question. Dr. Nagla, over to you.
Yes, I believe it is better to measure the change before and after, as mentioned before, because if you would like to know how much the program or the intervention have made a change within the community, it's very important to start up with the measuring what is the status right now. And then after implementation of the program, or for example, the awareness raising campaigns, we have to measure if the conceptions of the people has changed or not. And still this, the measurement is not an easy task actually. So you have to put into consideration the right tools to weight or measure what happened within the community. That's it, thank you. And I hope I succeeded to answer the question. Okay, thank you.
Dina, over to you.
Thank you. I mean, always a challenging question to actually track these changes, but definitely a little bit of what Eliana and Dr. Nagla has pointed out. How can we track these changes? I would say also going beyond the numbers that we see. So for example, we always see a commonality of, for example, how many girls are enrolled in schools, which is great, but we need to go beyond a bit what is behind this enrollment rate, right? How many are participating in student unions? How many are actually participating in STEM or interested in scientific research and so forth? So I think going beyond the numbers, going a bit more on the qualitative direction into how we interpret these phenomenons and going even beyond the regular measurable indexes and using the verified tools, whether it's most significant change, tracking down the change through stories in communities or the randomized control testing. I mean, there's so many ways to do it and it will have to be creatively done, but really looking beyond these numbers.
So there's a couple of things that I'm a bit obsessed about at the moment and for which I don't have an answer. So those would be what, I'm not saying it's the most promising avenue, but I think it's areas where we could really benefit from learning. One is, given all this quick spread of social media and how much especially young people are interested in, you know, following influencers and you know, these figures that they might certainly not know personally, whether how much that is a venue for changing norms. We take it for granted that we always need to change the people around you, your reference group, but now these reference groups is increasingly being made maybe of a few influential people. Is that a promising avenue or not? We have one study, but you know, it doesn't cover a broad spectrum of potential norms. So that I think is one interesting direction. The other is the feedback from behavior change to attitudes change, okay? So clearly it's extremely hard to understand if you want to change attitudes first and then behavior will follow, or if attitudes change only after people have seen new behaviors. And I think it's really a process that feeds in and of itself. So I do see some promise in trying to provide inputs, manipulate or shift some aspects. For example, with the media-based interventions, we would show behaviors that you yourself haven't taken, but someone has, and then see if attitudes change in response to that or vice versa. So I think these are all kind of very fruitful areas for future research. But of course, you know, I may be more stimulated by things we know less about than the stock we have already learned. Thank you.
Great, thanks so much all for your responses on that last question. So it sounds like the answer is we need a lot more of everything from Dr. Nagla's point, more measurement in general, maybe more pre-post studies from the JPAL perspective. We would also say, let's try to get some rigorous impact evaluations into the mix because there's so much we could learn. And from UNICEF, kind of running the gamut from qualitative research to really understand people's perceptions in depth, to rigorous impact evaluations. And Eliana, excellent to, I think, in particular here, that social media point, which picks up nicely on some of the use of social media in both NCW and UNICEF programs. So probably a lot of scope to try to be doing some more learning there. So I want to say thank you very much to all of our speakers today. Thanks to the National Council for Women. Thanks so much to our partners in the Global Evidence for Egypt seminar series, UNICEF Egypt, and then the support from Allianz. But I suppose if we were in the same room, we would all be clapping. So I'll give a little bit of a clap for our three presenters today. Thanks so much for your time and attention. And thanks to the audience for your really excellent questions. As has been mentioned in the chat, we will follow up with kind of a seminar brief that summarizes both some of the policy kind of challenges in Egypt, as well as much of the progress that's been made over the last several years, and then situates that together with the global evidence that Eliana summarized today. So we'll be sharing that with you in follow-up, and we'd love to keep in touch with all of you about ways that we can be working together on these really important issues. So thanks very much, and have a wonderful afternoon.